Hi, everyone. My name is Carolyn Springer, and I am presenting my capstone titled Enhancing Caregiver Education within a Level 4 Neonatal Intensive Care Unit. The focus areas of my capstone were education, program development, and advanced practice. For literature findings and background information, becoming a parent affects one's stress, sleep, and mental health. The transition into parenthood is often coupled with occupational imbalance, which is when one's time is dedicated to one occupation, such as being a parent, and this takes time away from being able to participate in other meaningful occupations. On top of this typical transition to parenthood, parents with their infants in the NICU often have an increased level of stress and anxiety due to the infant's medical complexity and concerns about their ability to become primary caregivers. So providing accurate and meaningful information prior to NICU discharge helps the transition home. And this procedure of transferring information from healthcare providers to parents is in need of improvement, which leads me to my purpose of the capstone, which is to enhance caregiver education through program development, research, and advanced practice in the NICU. For implementation, I created therapist educational materials and presented evidence-based practice from lunch and learn presentations and NICU huddle presentations. And those desired topics I presented on were gathered through a needs assessment I conducted at the beginning of the capstone. I also finalized one caregiver ed packet for NICU families. And I was also a research assistant on an IRB approved grant funded feasibility study. And this grant was looking at the feasibility of standardizing caregiver education in the NICU. I was on for the first quarter of this grant, and grant funding extends for the next 3 years. So during the first quarter of the research grant, I was able to participate through the IRB process. I prepared for the launch of recruitment and created therapist training materials. I conducted weekly participant screenings and enhance sustainability through the creation of a screening protocol that I then transferred over to the co-PIs, and they will continue to implement. And then I was able to participate in enrolling the first participant and complete the informed consent process and officially launch recruitment. Then I was able to develop and implement my own case series quality improvement study, and this looked at babies with neurological impairments and how occupational therapy affects the progression to oral feeding. I also was able to enhance my clinical competency through leading feeding, development, and handling interventions, and also got to complete caregiver education sessions in the NICU. For my results, I created 5 therapist educational materials and finalized 1 educational packet for NICU families. And I also facilitated 1 educational project for future implementation. This need was identified in the middle of my capstone, and it is to modify the current scar prevention Knowing No at Cincinnati Children's, which is a written handout that is available for the entire hospital. So we were finding there was a need to modify the education provided to tailor specifically for high-risk infants to better serve NICU families, since premature infants and high-risk infants have special skin considerations and different considerations for wound healing and scar mobilization. I also designed and implemented the case series, improved my clinical competency, and ensured sustainability of the screening process through that protocol and instructions I created. Implications for OT practice. So there is a continued need to inform clinicians on current evidence-based practice and how they can implement this evidence into their daily practice. And there is a need to determine the feasibility of the standardization of caregiver ed in the NICU, which the research grant will help to do this in the future. And it is crucial to have a proper presentation of caregiver ed, which will allow a smooth transition from NICU to home and allow those parents to have a successful transition into the role of primary caregiver for their complex infant and be able to facilitate healthy environments that their baby needs to learn, grow, and meet all of the developmental milestones. This is the QR code you can scan for my references, and thank you so much for listening.